I'm Tom Sincic. I'm a family nurse practitioner. I live in Multnomah County and I've been working in the school health centers since 1990. And I'm here to say, as a member of the Oregon Nurses Association and a longtime advocate for access to health care, I last came in front of the legislature in 2003 to fight for, as Chair Monis Anderson knows, for school-based health clinics. I'm glad to be able to speak to this committee today for access to care for everybody. I want to just tell a couple of stories from patient viewpoint. And that's where my struggle and challenge is. I want to tell a story of an 11-year-old girl that came to me a few years ago, very depressed, had lost 10 pounds, wasn't eating, was suicidal. She had health, whatever they call it. Insurance is a bad name. It doesn't insure your health. It doesn't insure you against bankruptcy. It insures nothing except for a profit for the company. So she had that coverage that you call. And but the trick was, who should she see? She didn't need to go to the emergency room. I could have hooked her with a psychiatrist, in a timely manner. So, but the first thing I had to do was find out which psychiatrist in town could she go to. Well, called psychiatrist number 1 on the list after we got the list. No, he couldn't see her today. Went to psychiatrist number 2. I knew a psychiatrist that was available. No, he couldn't see her today. I worked for 3 hours of my clinic time trying to get her access to the care she needed. 3 hours. Is that how I, under the public payroll, should have been spending my time while she had this thing called insurance? Well, finally, at the end of the day, had to send her to the emergency room. Who did she see? The very first doctor that I called, the psychiatrist in the emergency room. You call that a system? Is that how you want me to be spending my time, being paid with public dollars? Story number 2, very recent, another 11-year-old girl. And for those that don't know, a blood pressure of 140/90 is considered severe hypertension in a skinny 11-year-old girl. Well, she came into the clinic recently with a heart rate of 120 and a blood pressure of 138/88, not quite at the emergency level. She's an immigrant, therefore not insured yet, working to get her on the Oregon Health Plan, a team of people doing all that administrative work to get her the health care she needed when she needed. But her care was being delayed. Now, I do not know the current outcome of that situation, but I know we needed to monitor her blood pressure every day until she got to the cardiac or renal specialist that she needed when she got the health care coverage so she could go. We couldn't simply promise the family, don't worry about it, you'll be taken care of, because we would never know what it was going to cost or bankrupt the family. Third story, different kind. Young girl, mostly the kids are covered now in the state. A lot more kids are covered in the state than they used to be. But in this particular situation, I always wonder, why isn't your child covered? This is another 12-year-old girl, had a number of health problems. And it's very interesting. Why is after you ask what their problem is, the second thing you have to find out is what their insurance is. Is that how I should be spending my time as a provider? Is that how you as a legislative body want me to spend my time? Well, in this case, it's very interesting. Mom was there. We had a good conversation. Parents were separated. Of course, Dad was paying for some of the things on the kid. Well, it turned out Mom didn't want to have engagement with Dad around getting her under whatever plan because it was going to become a big dispute, family discord. Who knows what costs he was going to have to pay, battling over finances, and it seemed really, really terrible. It is, as people have been saying here, it's not a system. And the people that you as a legislative body are charged to be responsible for are suffering under the current system that exists in this state. And I'm asking you, like you did in 2003 around school-based health clinics, when The governor at that time completely gutted the budget of school health centers. The legislative body was wise enough to completely restore those dollars and think forward. And we know what school-based clinics are doing for access to care today all around the state. We need more than just that. We need access to care when people need it now. And we'll ask you, we know that eventually, as was said, there's going to be a ballot measure that's going to come to the state that the people are going to have to submit. And I'm asking you all to stand up and be behind and speak loud and clear, and let's get that thing passed.